So hi everyone, and welcome to the webinar. So I'm Rhiannon Evans, and I'm going to introduce you, and they'll also introduce themselves, my colleagues Lorna and Rachael, who have worked on the study. So today we're going to talk to you about a study that we've been conducting over the last year, which is looking at promoting the mental health and wellbeing of care experienced children and young people, with a specific focus on online and blended interventions and the experiences of that type of provision during the pandemic. So we're going to talk through, share the findings, have some reflections on recommendations that arose off the back of the study. Then we're going to talk about some in progress and completed research which is related to this, and then open up for some discussion then for your own reflections on your own experiences, but also helping us to think moving forward what we might do in addition. So I'm going to talk for a little bit, but then we'll circulate between the three of us. So you'll get to hear all of us. And probably just a note for this headline slide, I'll introduce Triumph in a second, and we'll return to the slide at the end, but just to flag the Twitter handle of Triumph and then the website at the bottom, in case you wanted to follow that up a little bit more afterwards. There's loads of resources around children and young people's mental health more broadly. Okay, so just to give a bit of context really for the study that we're going to talk about today, and the overarching network from which this study was funded. So in 2018, one of the main public health funders in the UK set up 6 large networks of mental health funding across the UK. So Glasgow University had one of these networks, which was called Triumph, and stands for the Transdisciplinary Research for the Improvement of Youth Mental Public Health. So it's not that catchy, but what it was intended to do was to bring together a range of stakeholders to develop innovative strategies to promote children and young people's mental health. So there was a real emphasis on having children and young people led co-production of mental health interventions, and try and progress perhaps from some of the approaches that we've had to date, which had mixed evidence of whether they worked or not. So within the network, there were 3 key groups of young people, or 3 key themes that they wanted to look at. So the first was key groups, which is what I worked in, which was looking at the mental health and well-being of young people who may have higher risk of poor mental health. And we had a focus there on care experienced children and young people, but also LGBTQ+ was the other group which were considered. And secondly, there was a real focus on social connections and relationships, so which was really looking at interpersonal relationships and enhancing there. And then the third theme then was about schools and other education settings, so trying to promote mental health and well-being through school-based activity. So that was the overarching network, and within that they funded 4 small seed corn studies that we called them. So they were initial exploratory studies which were trying to identify good practice or good ideas that could be taken forward to develop new mental health provision or interventions, or whatever we wanted to refer to it. So Cardiff University, in collaboration with the Fostering Network in Wales, secured one of these smaller grants to run between 2020 and 2021. But the pandemic dragged everything on a bit, so we are still doing it, as you can see today. But what we really wanted to explore within our smaller grant was the experiences really of developing and adapting online mental health interventions for care experienced young people, and the experience of that within COVID. So this really came about from initial conversations we had with the Fostering Network in Wales, and that rapid transition of all provision online, and trying to deal with the complexities of that, things around, securing digital provision, but also ensuring safeguarding and risk assessments whilst trying to manage and deliver services within this new context. And I think one of the things we have reflected on is that whilst a lot of this is done within the context of COVID, actually it will be potentially a more permanent move, as it might be more resource effective to do things online. So some of these recommendations are more long term. So we've got the next slide, Rachael. Thank you. So just the context really, or background of the study. So why we wanted to look at this. So generally we know that young people with experience of care tend to have poorer mental health and well-being compared to the general population. And the COVID pandemic adversely impacted mental health across the board, but also within this population. So there was cited experiences of isolation, digital exclusion. We know a lot about the digital divide, perhaps young people who may have less socioeconomic resources, are more rurally located, have poor access to the internet and equipment. There was the financial precarity, particularly amongst care leavers, and just the general lack of access to support services. A number of services had to be halted because of the pandemic, and then in some cases there was oversubscription to services. And as I already mentioned, you know, in this we then see this rapid transition to online or blended provision for services, where they were either purely done through telephone, internet provision, or some combination of where appropriate and feasible in person, but also then combined with online. Next slide. So the aim of our study was really to understand what's important to young people fostering kinship carers and practitioners in terms of the mental health and wellbeing services for this group, and considering the experiences of this different type of provision. So there are three central research questions that we asked. So firstly, looking at, well, how did the COVID-19 pandemic impact on provision of mental health and wellbeing services for this group? And thinking primarily then about the relative strengths and challenges of this different type of provision, and how were they working. And then the recommendations then really came from this third question about, well, what improvements can we make in the format, functioning, delivery, acceptability and accessibility of these interventions moving forward, especially if we think that it might be a longer term approach. Next slide, please. And the research methods then, so it was a smaller study, and as we've seen across the board, there were some challenges in recruiting some young people, potentially because of some of the issues that I'd already suggested about the experiences of the pandemic. But in total, we had 4 young people, 3 who were care experienced and 1 with parents who were foster carers, 10 foster and kinship carers, and 9 health and social care professionals. And we conducted interviews via Zoom or Microsoft Teams with them. But once we'd collated this information, we also did a range of consultations in order to further refine, particularly the recommendations, with 3 groups. So we met with the Foster Network's Always Foster Carer Advisory Forum, Cascade Voices, Rachael actually met with them again last week, and then the Foster Network and Wales Young People's Care Forum. So I think it's important to recognise that whilst we didn't necessarily have the voices of young people in the data to start, we did broaden out and have opportunities for them to reflect later on. So I think just to help us guide through the rest of the presentation, and particularly the discussion at the end, we're just wondering whether you would be able to put in the chat really kind of who you are and your professional role, and what you might be hoping to gain from the session and discuss later. So we can just kind of try and tailor it a little bit as we go through, because we don't really know who's here at the moment. So we'll carry on, but if you're able to do that as we go, that would be really helpful for us, just to give the indication. Fab. So I think we're just going to move on briefly, quickly, and move on to the findings. So I think I'm going to hand to Rachael now, and she's going to start us off.
Yeah, thanks, Rhiannon. Hi, everybody. My name's Rachael, and I work at Cardiff University at the Cascade Research Centre, and I work here as the engagement manager. But I supported this project, and I supported a young person who is care experienced to be a co-researcher on the project from our Cascade Voices group. So I did all of the kind of the prep work and the interviews with our peer researcher, Brittany, who couldn't be with us today, but was a key part in this project as well. So next, just before we start talking about the themes and the findings that came out of this project, we just really wanted to highlight and let you know what we found in terms of the online services that young people and carers were using during COVID. So there's a list here of the things that came up during our interviews. And really shows kind of the broad range of services and things that we were talking about during this project. So whilst it was about mental health, there was a lot of focus on well-being as well, so some of wider services. So online forums, so such as Facebook groups, CAMs and counselling, so that kind of more higher level intervention and support, but also then online peer support groups, Apps, so mindfulness apps, things like meditation things on YouTube was talked about. So there's kind of lots of variety in terms of wellbeing support and things that people access that way. We talked about accessing GP and how that was done on the phone. School and education online was discussed a bit, and the kind of support and the wellbeing factors and protective factors that presented, and wider additional kind of online activities. So I think the example here is Scouts, but other things that people were getting involved with for their well-being that had all kind of quickly transitioned online, as we all know. So an interesting fact here and something to really think about is that most carers said that they hadn't used formal services, but really relied on informal relationships or relationships with other carers and social work teams to kind of know what was about. And this leads us into our findings. So these are the key themes that came up, and this is what we're going to kind of discuss and delve into in a bit more depth now. So the first one was awareness and access, then choice and flexibility, safety, protection and risk, training, and then resources. So we're going to take each of these in turn, and between the three of us, then we're going to talk in a bit more depth about them. So the first one is awareness and access. So as I've already touched upon, there was a real lack of awareness about services that were available. In fact, quite a few of the foster carers that got involved in this study shared that they'd actually been interested in getting involved to learn a bit more themselves, and that's why they kind of engaged with this on this. And I think they felt really that things needed to be much more clearly advertised for foster carers and wider carers or kinship carers, but also for older young people. And that's what really came across for young people that we spoke to who were all older and care leavers, that they really wanted that independence to be able to access things themselves. So when talking about what kind of service they wanted or what they'd accessed, what they mentioned as like a key gap and something they really wanted was something that was easily accessible and instant. So something that they could just click into and they could have someone to talk to, or just immediately link in with somebody, rather than perhaps a service where there's a waiting list or a referral or something that takes quite a lot longer to engage with. And also thinking about the timings and thinking about when they can get access to things. It's 9 to 5 within work hours and all that kind of thing, which doesn't always suit carers and young people. So those were the key things in terms of access that came up. But what was really clear is that for the limited remote provision there was, when they were universal services, they weren't always linking in or didn't have that awareness of what the specific needs, terminology around young people that are in care. So this is this quote here from a young person. There are a lot of kind of terms and stuff that you're talking about people don't know. So they already felt like the service, they had to catch the service up, they had to explain their circumstances more than perhaps was necessary. So thinking about services that are tailored specifically to care experienced young people and are aware of the circumstances and the terminology and the individual needs of that group. And then this bottom quote then from a foster carer, which is really highlighting that, you know, we know mental health services, one of those things that you sort of, I suppose, you know about it, but you don't necessarily think about it when you need it. And it's thinking about exactly what's needed, having those conversations, having the confidence to know what you need, and in the moment, what to link into, who you need to contact, who do you speak to, and where do you go. That's quite different from just having a list of things that you might want to call, but that transition from what is needed, what does the young people say, what is how do you approach the subject, how do you have that conversation, and then linking that in to accessing a service and being able to get that help in a timely way. All of this kind of really compounded by young people that were at home all of the time, so there wasn't kind of wider service provision, nobody else was kind of having those conversations. So the next finding is choice and flexibility. So a clear point here that came up across kind of foster carers and young people's feedback was that there was a need that this was really young person centered and tailored to the individual needs, and that we were thinking about the young person rather than what was available and trying to push people into what they had rather than what was needed. So, for example, foster carers spoke about needing to really get to know the young person first, and really speak to them to really identify and understand what their needs were before making a referral, and make sure that something that was put in place that was needed, that was necessary, and that the young person was really going to engage with, because they knew what was happening, they knew all the people that were involved. The move to online provision meant that they often weren't meeting people in person to begin with, they were just meeting online. So how do they develop that relationship? Do they know who they're engaging with? Do they know who their services? Did they know who they're talking to? And that was another really key point from foster carers. They really cautioned that sometimes there are so many professionals involved with the young person that they don't want to keep repeating the same thing to everyone. So who are they speaking to? Who gets told what? Are they talking to the right people? Do they know who they're speaking to? And all of this really needed a rethink, particularly when all of the engagement was online. It was just another screen and another person without wider relationship building. From young people then, they spoke a lot about they wanting something easy to reach out to and somebody to talk to, and someone of their choice as well, and someone and in a way that worked for them. They talked a lot about peer support. You can see the comments on the right here from young people about building a sense of community and friendship through the screen. So being able to access that and having their well-being needs met, and also knowing that they weren't alone. And so in this second quote, I could see what other people were posting, that it was like the same things, they were similar, and I could see it and think, oh, that's the same as me. So knowing that, you know, that other people were feeling the same way, other people were in the same circumstances, and that they weren't the only people feeling like this, and that was really important. And a really key point here is that they wanted some kind of ownership. The young people, they wanted ownership of service choice and the way that they chose to engage. And that was really important for them, for that flexibility, because that could change over time as well. There were some real positives and negatives to online provision and the shift of everything online for everybody involved. So from the young people particularly, talking about how actually just being online all the time could be tiring, and it can get really boring because you're not doing the same kinds of things as you would do in person, and that kind of active element was kind of taken away. Technical difficulties could be frustrating. I mean, I think we've all certainly faced that, but particularly if you don't have the right resource to begin with, or as Rhiannon already mentioned, in kind of remote areas. But actually there were real positives as well in terms of autonomy for young people, so they could make more choices for themselves. So actually if they were in something and they didn't like it, they were able to leave easier than perhaps they'd feel comfortable doing in an in-person setting. There was that choice that they were able to take on. And also they also kind of got more involved in things because of the fact they didn't need to travel anymore. And if anyone was already struggling with mental health or anxiety problems, actually linking in on a computer in the safety of their own home and being able to keep the camera off meant that they could start engaging with things and start linking in and making connections, and then decide whether or not they wanted to put the camera on themselves. So this was something that was really talked about by both young people and professionals. But professionals could see the positives to this, but also worried a little bit about if they were fully engaging, if they didn't have the camera off and they weren't sure if they were getting from the session perhaps what they were hoping, because they weren't really able to see them. So there were some barriers there for the professionals, but the young people quite liked that autonomy and freedom there. But similarly, the inclusion of online provision was discussed in a real positive way from professionals, because it cut down on their travel time as well, and made them able to access young people that perhaps wouldn't come out to a meeting beforehand, and suddenly they were able to start working with them and talk to young people more in a way that they were more comfortable with. Some other things that we talked about in terms of autonomy was a young person, one of the interviews discussed contacting a GP themselves. So they could do this on the telephone, and they said they perhaps wouldn't have done it if they knew they were going to have to ask for a lift, and then have to go to the GP's office. So by being able to contact a GP themselves and have that telephone consultation, they were able to have conversations that maybe they weren't comfortable having or having to declare to anybody else. But a real kind of key point from both the foster carers and the young people was that kind of higher level services such as CAMS and counselling, they really felt that this needed to be in person where possible. And and the earlier discussions about really being able to build a relationship with a young person, that's key. And then if everything has to move online, then afterwards at least you've kind of established a relationship already, and that really made a massive difference. I think we're going to the next one. Over to you, Lorna.
That's me. I guess I should introduce myself a little bit then, because Rach did a good job of doing that at the start of her part. So I'm Lorna Stabler, so I'm a research associate in Cascade here as well. And I did most of the foster carer interviews. So I might focus in the next couple of slides a little bit more on the kind of foster carer perspectives as well. And really, we had, I guess this is a little bit different from some of the stuff we've been talking about, because we had this almost secondary question about how foster carers and professionals were able to carry on their kind of safeguarding duty and role in the context of things moving to remote services. And there was quite a mixed response from professionals and foster carers. And I guess just to start this, the people who did engage in the research were obviously people who were quite comfortable. We did the interviews online, so they were comfortable and able to use online provision anyway. So there may have been some foster carers and professionals who found it harder, who didn't take part in this research. So just to make that point at the very start. But yeah, so we had some quite mixed views. I think you can see, I'll start with this quote on the side from a kinship carer who essentially said, it's fine, we do everything the same. It's just, we manage to get to the same place, whether we do it by phone, whether we do it face to face. When we have really serious things that we need to talk about, they can be addressed. It doesn't matter what the method was. However, some carers had a slightly different experience of that. So for some foster carers and kinship carers, they felt they had more responsibility to be making decisions about the kind of activities and the level of risk that young people were involved in. And for some, that was a really positive move. We had a real range of experience in terms of foster carers and kinship carers. So some had been doing it for a very long time and actually felt that they'd had this young person living with them for a long time, and they were best placed to make some of the decisions that usually would have to go, through the social worker, and that they could kind of have a little bit more of a role in kind of making decisions about what the young person could do. However, for some of the foster carers who were newer or had kind of newer young people there, they felt like they didn't necessarily have the same safety net of being able to have a social worker come and talk through some of the implications of the decisions that were being made, or whether or not a young person could go and stay with her boyfriend, for example. Another carer talked about the difficulty of explaining gut feelings and inklings that they had when they had to put everything in an email. So the example here, she was talking about a young man who she did have a very good relationship with, who'd been there for a long time, and she started to feel like something wasn't quite right, but she didn't know how to have that conversation because there wasn't anything specific to point to. And she felt that if she was in a room with the social worker and maybe someone from school, they could kind of work that out in a conversation, but it wasn't something that was felt to be done as easily when you had to put things in an email or make a phone call. And in addition to that, it was very difficult, particularly during lockdown, when everyone was in the same house. So having those conversations when actually the young person was also in the house was felt to be really difficult. And in that scenario also, they were you might be caring for quite an age range, so it wasn't as simple as she could go out for a while and have that call. So it felt like there was something maybe missed there, and particularly thinking about carers who didn't have a really strong relationship with their supervisor and social worker, so they couldn't articulate things based on a kind of shared understanding and relationship. Again, as well, that idea of not being able to have conversations from multiple perspectives and voices, so not having everyone in the same room. I know we've all had the experience of doing online meetings and things now usually, but it was felt that not everyone could participate in the same way as you could if you were around a table, and particularly for young people, children and young people who would usually be at school. So actually the school would play a really, really strong role in thinking about how the young person was doing, monitoring their well-being, and actually would have a totally different perspective from the foster carer, because they would see them around other children, they could see them in their normal daily activities, and not having that additional perspective made it quite difficult for foster carers to really be grasping what was going on fully with the children and young people's mental health and well-being, and being able to understand whether it was just a normal response to being in a global pandemic, or whether there was something more going on, and not being able to have different people to kind of unpick that with. There were quite a lot of carers who talked about how difficult it was to get in touch with social workers during the pandemic, and I would say that wasn't that's not unique to COVID. So in other research we have found that carers sometimes struggle to get in touch with the social workers when they need to, because there's quite increasing workloads, and if a social worker goes off sick, but particularly when they were relying on emails, they found it even harder. And in some cases, there was a phone that they could call, but there wasn't anyone in the office, so the technology hadn't been moved early on, so that call to the social worker actually went to their desktop computer at home or their mobile phone. It was still ringing in the office or something like that. And then there was, I guess we expected it, but there was a lot of uncertainty from carers about using technology themselves. So which kind of software was safe, what was secure, and even I think there was a lot of mixed messages more widely, but within local authorities as well, about what was more secure, Zoom or Teams, what the difference was, whether things could be recorded or couldn't, and then how things could be shared to make sure that they were secure, but also around the young person using services. So, what was an official service? What was, who was on the other side of that when you couldn't see a face? And I think also just most people's home internet systems have been set up without thinking about transferring a lot of confidential information and making recordings and things like that. So there was just a lot of uncertainty around how to keep things safe and confidential, and understand how these things operated in this new realm that people hadn't really explored beforehand. And I guess for professionals, I think this quote kind of sums it up a little bit. So professionals were in this kind of new world of having to do things online, but without guidance. So yeah, this one. So if you work for a service and you're allocated, it's really difficult to say, actually, no, there's no guidance for this, and I don't feel that's appropriate. Go and do something, even if you don't really know the best way of doing it. So there's a lot of pressure. You've obviously got the flip side of carers saying they can't get in touch with social workers and they can't get things done, but then you've got professionals saying, well, we don't know how to do these things now. And rather than, a lot of them didn't necessarily want to say we just can't do it, so they would try and do it, but actually how sufficient is that if they don't have the right guidance? So it leads to kind of delays, but also some professionals are saying we just don't know how to do it, so not doing some of the things they might need to. So there was one example where there was a young person who was pregnant, and it hadn't been approved at the start of lockdown that she could go and stay with her boyfriend. So then she was never allowed to go and stay or see her boyfriend through lockdown because that risk assessment hadn't been carried out, and then it couldn't be carried out because they didn't know how to do it remotely. So actually, you know, through the first months of her pregnancy, she couldn't see her boyfriend, which was really, really difficult for her and for the carer to manage. Internet cutting out, I guess Rachel's talked about this a little bit as well from the young person's perspective, but there was a kind of worry from professionals that if they were partway through delivering something and then the internet cut out, that was it. Like, that young person was then left, you know, partway through something, and they didn't necessarily they couldn't go round and check the young person was okay. You know, if they called, it's not really the same, or a young person might answer the phone. So there was a lot of discomfort around that, and losing the meaning of some words. So even if the internet cuts and you just lose a word, it can really change the meaning of what a young person was trying to say and make a young person feel frustrated and not heard or understood. And again, like, thinking about those like multidisciplinary meetings, I'm sure we've all had the experience now of, you know, someone who's meant to be in the room not actually being able to enter the room, or being kicked out of the room, or something like that. So if a young person was in a meeting with other professionals but they didn't necessarily have that relationship with, if the social worker or, you know, the person that the young person knew happened to leave the meeting accidentally for whatever reason, there was this concern that they would then be left in a meeting with someone that they didn't have that relationship with, and, you know, what impact that could have on the young person. Even if it's just awkward, but also, you know, from a much wider kind of, you know, worry about who a young person is left with. And I think it's something that is talked about a lot in terms of face-to-face in-person meetings. So who is appropriate to be in a room with a young person on their own, or a child, but there's not necessarily been the same focus of, you know, these online spaces also being rooms and spaces that young people and children are in, and how are we making sure that they're not in a room, you know, with someone who's inappropriate to be one-to-one with them. And finally, and I think we'll talk more about this later on as well, so from a young person's perspective, and as Rach was talking about, it could be quite empowering to be able to switch the camera off, or it can feel more comfortable. Like now I can see my face speaking, and I really hate it, so I'm trying not to notice. So for young people, you know, especially when they were doing school online, expected to access services, you know, maybe speaking to their friends as well, having a camera on all the time can be really uncomfortable. But also sometimes talking about really difficult things, it's easier to do when you can't see your face speaking back to you. But for professionals, they felt it was really hard for them to actually essentially do their job in terms of thinking about mental health and well-being of a young person. So they couldn't assess body language, you know, they couldn't, you know, see if someone was smiling when they were saying something, or how uncomfortable they felt, or even if there was someone else in the room with them. So, you know, they weren't entirely sure of the wider kind of context around the child or young person. And that, I think, you know, professionals felt really quite uncomfortable with that, because they felt they only had half the information. I guess the flip side of that is there were professionals as well who really saw that it was good that young people had that additional choice that they don't normally have, because often you get taken to a room as a young person and you have to do this thing and you can't leave because someone drove you there and you're relying on someone to take you away. So actually they had a bit more choice, but that left professionals in quite a difficult position, especially if they hadn't, you know, agreed ahead of the meeting what would happen in those circumstances and how they were going to manage it. I guess the other thing I just wanted to mention on here was that for young people, children and young people in care and leaving care, they don't always have a private space where they can be having these really confidential conversations. So in the fostering home, there was discussions around, well, there are other children, there are other adults there, and it's really hard for that young person to speak openly and feel confident that people aren't overhearing. And particularly, you know, you speak to a lot of care leavers who are in accommodation, you know, they're in hostels, they're in, you know, these overcrowded spaces where they don't have, you know, a nice, you know, separate room where they can go and sit and engage with this kind of work. And what what implication does that have for their safety outside of engaging in that session? And I also want to mention, because I think my foster carer is on this webinar, that we kind of had a conversation about it this morning as well. And one of the things that foster carers really felt was that moving things online meant there was no real space for them to take part, and that, you know, sometimes, you know, particularly for young people, if they were comfortable, for children and young people, the foster carer could play a really key role in terms of introducing the professional, helping the young person understand what their role was and why they were there, helping them to understand the benefits of taking part, and maybe supporting them for the first couple of sessions. But that once things moved online, there was just all of these professionals, and the carers had no idea who they were, didn't even see their face a lot of the time, because quite often things were done by phone, and the foster carers weren't able to kind of help manage that relationship for the young person if they wanted it to. So carers were almost cut out of the equation, and then but still expected to keep that young person safe in that online space, despite the fact that they were excluded from it. So it's quite a difficult one, I think, for foster carers to manage. Rich, could you? Okay, training. So I won't talk much about this because I talked a lot about the previous one. But essentially, as Rachel's already mentioned, the biggest thing that came up was that, you know, particularly carers just didn't know what was out there. There were a lot of services, but they weren't aware of what they were. So that kind of general training around kind of what mental health services are there, but also for which needs. So it might be that there's, you know, a service that they know about, but they don't really know what it does and what the benefit of it might be for young people. So better signposting. In consultation, carers and young people talked about a need for a kind of hub of services. So they're just a central place where they could go and know kind of how to access something. But there was also conversations about needing more training around how to have some of these difficult conversations around mental health and well-being, and how children and young people were feeling. And then for carers to understand, you know, what that meant in terms of what responses would be helpful. They also talked about, again, a little bit like what I was talking about before, how to support young people to build relationships online and to understand online safety for young people and for carers. There's this kind of assumption that like young people just automatically understand technology and they know what they're doing, but actually, you know, there's still a big gap in knowledge for carers and young people there. How to use technology was a big thing that came up, so carers just feeling excluded from that space because they just didn't necessarily have the skills to engage with a lot of these services. And then how to support carers' own mental health. It was one thing that really came out strongly, that carers talked about supporting children and young people, particularly through the pandemic. And then when they were asked, what have you engaged in for your own mental health and well-being, one carer laughed when I asked. You know, they hadn't had that space to really think about how to support themselves, and if there were some of these new services that were going to be online that maybe they could access after a child went to bed, they could be helpful, but they just hadn't even had a chance to think through that and how it might work for them. And professionals, again, like some of the stuff that we talked about previously, but also just that idea around how they're trained in digital skills, but not in a limited way. So not just using Zoom, but how can you think about the whole spectrum of different types of things that you could be doing online with young people, and how you could be engaging and thinking about, rather than just getting used to one way of doing it, how you can really develop lots of different skills to work with young people. And I think maybe we can talk about that in a little bit around participation, because I saw a few people asked some questions about that. But also how rather than expecting young people to have to keep their cameras on and engage with professionals, how do professionals learn to engage young people online and build those relationships? So flipping that the other way around a bit. I think that's me, Rach.
So I'm just going to talk about the last recommendation now. which probably in a way is one of the most vital, and everything else is contingent on it. So we did say at the start about a lot of the issue related to online provision is around the concern of digital poverty and digital divide. So I said this relates both in terms of a geographical spread of people and access to internet, but also just access to IT technology. So I think this came up as a strong theme about currently young people in care, but also their carers don't have the resources to fully support them in accessing services online. So they felt that there was a lack of availability and investment in appropriate technology, but also where there was available technology, they often had prohibitive access restrictions. So a lot of young people said that perhaps the only laptop that they had during the lockdown was from the school, but the restrictions were set up that they could only access the portal of their school to catch up on homework or whatever it might be. So everything kind of came with restrictions for them, and they didn't have the opportunity to navigate online spaces in a way that felt supportive of them. So there was just a quote there from one young person when they talked about some of the challenges of online, about the financial aspect of it. So there's a whole, do they have a phone, cost of the internet, maybe not got access to internet on the phone, or they've probably not got their own computer. So I think this kind of causes a barrier with online resources. And I think it's important the whole family share one computer, and it may not be somewhere where they want to go and deal with their kind of deepest thoughts and stuff. So this links back a lot to what Lorna's spoken about, also Rachael, about ideas about privacy, safety, and what young people are trusted to do. And this idea of perhaps monitoring things on shared computers, but they may in turn not then feel quite comfortable exploring their mental health, especially if perhaps one of the causes of their poor mental health might be the family that they currently live with. And then there are wider structural issues that we see across the board, and these sometimes feel intractable and can't be in all studies that we look at. So a general lack of mental health and wellbeing resources for children and young people. So this came up particularly for care leavers, and we see the age-old issue of young people hitting the age of 18 and having to transition into adult services, perhaps not feeling prepared or supported in that transition. Or particularly in the third sector, there are resources, charitable organisations which will provide things up to the age of 18, but once you reach that age, that can drop off and young people are left unsupported. But there's also, many of you will know, wider sort of structural issues and socioeconomic issues around just safe housing for care leavers, continuity of financial support, etc. So a lot of the causes of poor mental health continue and are sometimes exacerbated in the care leaver population. But also we kind of see that there are also opportunities to develop new resources like this. So one of the quotes there from professionals, so we've developed a skill and a resource that we would probably never have used if we hadn't been put in this situation. So that is great. So we are seeing adaptability on the part of professionals, and it's not all a negative picture, but we're seeing creativity to try and work to build new provision and resources in order to support young people. So the next slide. Thanks, Rachael.
Thanks, Rhiannon. So before we sum up the recommendations following this project and then hopefully have a bit of a discussion, when we were putting together this webinar, we thought it was really important to try and highlight the opinions and thoughts of young people, particularly because we spoke to so few and interviewed them in this project, because it was quite difficult to recruit. So the wider consultation was really an opportunity to talk through some of this a bit wider. So last week I met with Fostering Network Wales's Young People's Forum, and we talked about this webinar, and we talked about the findings, and they gave me some key messages to share, which is what I'm going to do now. So some of the key things they had to say was that having access to phones and iPads, for example, is really important for them to be able to contact services independently if they want to, or some kind of independent route to access. choice and flexibility. So this is a real specific point about partway through the pandemic, that they really felt there should have been an opportunity for services to have switched outdoors for those that really weren't happy engaging online, and that really need to allow for that flexibility. And I think whilst we're talking specifically about the pandemic here, I think that kind of idea about approaching things more flexibly and thinking about outdoor spaces as well for young people is really something that can follow through. In terms of safety, protection and risk, they felt, I mean, one young person spoke about the fact that engaging with counselling online in a shared space, they just didn't open up the same. They weren't going to get enough out of it, and they were just really worried about being overheard. And that's really something that we need to be thinking about when we're offering this provision in this way. And they talked about needing to train and help foster carers to support a young person after a session, particularly if they've not actually gone anywhere for that counselling and they're just still in the home. So they said services perhaps need to contact the foster carer, just like came up in the wider research, and really perhaps engage them with what's happening so they can best support the young person. And then finally, they thought whatever happened, whatever research, whatever happens after this, it really needs to be developed with young people. Obviously, in the pandemic, everything just switched immediately online and there wasn't really that time. But now we know that, I mean, it's likely that a lot of this will continue in some form. So we really need to be thinking this through with young people about the best way to deliver it and make sure that we're hearing from them. And similarly, training with foster carers and how to support young people after online phone and counselling, and what that means when you don't go out somewhere and the counselling space isn't separate to the space that you're living in, and how important that is to really realise and find a way to support both foster carers and young people in that way. And then finally, about awareness and access, the young people spoke about really preferring text, to be able to text message or engage that way rather than having to go places. And they really wanted something that was flexible and easy for young people to access, again, independently. They really liked the idea of online networks or instant contacts that they could just click a link and get into. And it's just about knowing who and knowing what they can get access to without having to go on referral lists. And those were the key messages they wanted to make sure we shared. I think, Rhiannon, you're just going to run through the recommendations before we take questions.
Yeah, sorry, I was just wondering if Lorna was going to come in at that point for the next slide. Yeah, so I guess just to summarise then, to help us on the discussion, that we had sort of 5 key findings or recommendations that we've based our results on. So just to reiterate, so the first really is about training, so ensuring that training is available to carers and supporting young people, and increasing awareness of mental health services. There's also some scope for training for professionals as well. And that awareness and access, relatedly, that we need to find ways to make sure the services are clearly advertised on and made accessible for young people. And for older young people, is an issue about making services independently available for them. Choice and flexibility is one of the central principles that we want to try and operate in moving forward with services, that everyone has the choice to select the services that feel most right for them in terms of meeting their needs. And this includes the format in which it's delivered, and this flexibility to change and transition as services unfolds depending on changing needs. And then Lorna centred a lot this sort of central issue around safety and protection and risk. And young people in foster care just needed more guidance on how to engage in a safe and risk appropriate manner when using online services. And then I finished then with the sort of fundamental basic issue about having more resources for the technology, that they can be accessed as needed. And then just the wider climate of funding for services to make sure it's available to all young people in care, particularly care leavers. So I think Lorna's going to finish off now.
Yeah, well, I was just thinking, we've put these questions in for discussion. So if anyone wants to kind of reflect on those and send any questions and comments, we do have a couple of questions already. So if you two, if Rachel and Rhiannon, you're happy for me to take those.
Yes, go ahead.
And then I was worried that no one would want to discuss anything, so I'd made some notes to stimulate discussion as we went through. But luckily, people are happy to chat. So, James, you've asked 2 questions. So the first one on basic income. I won't talk too much about that because I have a lot of opinions. I am happy to talk to you about it afterwards. But I think so. At the minute, for anyone who doesn't know, it's been announced that in Wales there'll be a trial of basic income for care leavers from the Welsh government. So they'll get £1,600 a month, which I guess what Rachael and Rhiannon also were talking about is, you know, the wider causes of poor mental health, and part of that being poverty and lack of access to resources. So at the moment, yes, on paper, that could help alleviate some of those issues. It has to go hand in hand with support. You know, young people leaving care, particularly at 18, money. When we talk to people, money isn't the first thing that young people ask for. You know, when they say what's missing at that point, what they need is, you know, independent living skills, decent accommodation, support, like positive friendships, access to services, to remain within foster care with the foster carers that they have a good relationship with. So I think it will very much depend on the support that goes with that money. And one of the risks, as I see it anyway, and I know other people have seen this as well, is the scrutiny that is going to be on young people leaving care getting this money. And already we've seen a lot of negative media attention directed towards young people leaving care, and there's already so much stigma around it. So now the conversation of, like, you know, these kids getting money for free, I think could have a negative impact on their mental health, depending on how well it's managed. So I guess my answer is we'll see. We'll see what happens. I don't know if Rachael and Rhiannon, you wanted to say anything about that.
So I mean, just to follow up perhaps on the research side, I can send you the paper, James. We just published a paper on the importance of different types and sources of social support for young people who are in care. So it was a US-based study that we did, but it was looking at 3 different types of support. So there's emotional, informational, like advice support, and then financial support. So young people in care have really low levels of financial support generally, which I think we probably were. So this is really important in addressing that, and can go some way, because financial support is important for mental health. But what we also found in the studies actually was probably more important for young people in care's mental health and positive well-being is having emotional support and informational support, just someone to have like practical advice. So this is kind of only like one stream of support, I guess, what Lorna is saying, and there is evidence to suggest that you need to have adults who can give you those other types of support to have really good well-being. So it goes some way, but we need to make sure those other things are happening as well.
I guess, so there was another question, James, as well, about thinking creatively about how we use space for provision. And I think that's such an important one. But also, I guess the thing that we've mainly been trying to say all the way through this is it's so dependent on the specific young person. So, you know, some young people have said very strongly over decades that they don't like services being provided in schools. They don't like being taken out of lessons because it's really, really stigmatizing. However, you know, there are other young people who would prefer that because it's in a setting that they're already comfortable with, they're already there. So I think really one of the things we wanted to look at with this research is how do we co-design our delivery with young people to make sure it actually does work for them. So I think if we were to think more creatively, the starting point would be to think more creatively about how we work with young people to design these services in the first place. So it could be that delivery in, you know, further education colleges is the way forward, but I think before getting to that point, we need to work with young people to think about what that would look like for them. I don't know if you wanted to say anything on that, Rach.
No, I think you covered it.
If there's no other questions. I can't see any other questions. We did have just a couple.
There's one more question from Emily. About apps. So it's not really a question, it's more of a comment. But basically, Emily, the next slide will hopefully address it, because we have reviewed counselling services. So hopefully if I flag this might just be a useful discussion point as well. Yeah, so we've sort of given the central recommendations, but we did have a research related recommendation that we're now trying to work on as the research team. So, I mean, you might feel this is a recommendation from all researchers that we need more research, but there are remaining gaps that we have. We actually know very little about how to support the mental health of young people in care. And particularly just about different groups of young people. Often they just get treated as this homogenous group. And we've already said, you know, there was the particular experiences of care leavers, but also things about different care placements. Predominantly here we've had about foster care, and foster care often gets foregrounded as the biggest population, but there's definitely things about residential care. Lorna's work is on kinship care outside of this, so there's loads more that we still need to understand. But I just wanted to flag up a couple of studies which some of you have contributed to and are involved in different ways. So first was that in March we published a review of the school and community-based counselling services in Wales. So if you go to the Welsh Government website, there's the full report, a stakeholder summary, and then a young people version, which you might want to share with your networks of young people. And that provided a comprehensive list of recommendations, which link to a lot of the things that we've been asked for today. One of the central things was about young people needing more information on how they access counselling and what counselling is for them. The Foster Network in Wales supported on that study, and there were some specific points about care and a big gap of foster carers in particular not really knowing how to support the mental health of the young people they care for, how to access and work with counselling services. So that might just be something to pick up on. Then the second study then, which is the biggest burden in my life, is a systematic review that we're trying to do, which is looking at the evidence base for mental health interventions for children and young people in care. So we're in the process of writing that up and doing consultations with Welsh Government, Public Health Wales, young people carers. And the central finding from that is that currently the evidence suggests that parenting interventions, which improve the parenting skills, particularly of foster carers, are shown to be effective, as are curriculum-based programs for young people, which tries to develop their social and emotional skills. But Rachael might speak more to it, but when we've done consultations in Wales, everyone disliked these interventions and had a lot of issues with it, rightly so. So we are a little bit back at the drawing board of thinking about actually what should we be doing for young people to support their mental health. So hopefully we'll be able to come to this group and other groups and kind of do some more work moving forward to think about actually what are the mechanisms that we're using to support young people. And then Lorna's going to talk about another study that we've just got funded related to this one.
So I'm not sure I'm going to have time to talk about that, and Sean will have my life if I don't share this poll. So if everyone, if you're still here, there's just a really quick poll here just to think about how the session was for you today. You could take just, a few seconds to fill that out. That really helps us to think about the impact of what we're doing. And this next slide was around, we will be working with children and young people who are care experienced to look at what services are available, test them with young people, and provide that kind of online resource hub so that hopefully foster carers and young people will have a central place that they can go to know what services are there and how good they are at actually working specifically with young people who are care experienced. But I won't go into that because I know we've run out of time. But yes, if you could just take a couple of seconds to fill that out, that would be excellent. And I think we are dead on 12 o'clock. Do you want to say sum up, Rach? Oh, there we go.
No, just if anyone's got any comments or any thoughts, please share them in the chat, and feel free to contact us as well if you want any further discussion on this or access to any of the information that Rhiannon has mentioned. The full report for this project is on the Fostering Network Wales website, and we'll hopefully Shard might be able to put a link in the next, I think we might have already linked to it before, but a link in the next ExChange bulletin as well. So for anyone that's missed it, they can get it there.
Yeah, I think Dawn also put a link in the chat to that full report as well.
Excellent. There we go then.
Right.
Thanks, everybody.